The first diagnostic question is where we rule out any red flags that deal with different pathologies or cancers or fractures that might be in something that is life-threatening. We try to determine any red flags from an extensive history, examination, and possibly a specialized neurological exam. The second diagnostic question is all focused around determining where the pain comes from. We do this with a continued history and a specialized examination process to help determine exactly where that pain is coming from. Once the red flags are eliminated, we usually narrow it down to 4 possible categories that someone might be having their pain come from. One of them could be disc derangement, another could be radicular pain, another one could be joint dysfunction, and the last is myofascial pain. For diagnostic question number 2, we do a specialized examination process in order to determine exactly where that pain is coming from. The third diagnostic question is used to determine if there are any aggravating factors that are actually happening in someone's life that might prevent them from getting better. Some of these things consist of their depression, if they're having any, anxiety. There's another called self-efficacy, which is basically when the patient is not complying or not following through with their treatment. There's also catastrophizing, which is whenever they are constantly thinking the worst is going to happen. So we may talk to them and all they're focused on is the pain getting worse. Usually in acute patients, some of these factors don't affect them just yet. The more aggravating factors come from patients who are either chronic or subacute. And what I mean by that is it's something that is constantly reoccurring over a long period of time, or they're just never getting better. Before we can rule in any of these aggravating factors, an acute patient needs to go through a trial of care to determine whether or not our treatment plan is actually going to help them. And then we can try to focus on the aggravating factors in order to let them get over that little hump to get better.